Well, historically, students that are studying nursing, midwifery, and the allied health sciences, including OT, physio, radiography, have had their tuition fees paid by the National Health Service and have been in receipt of an NHS bursary to support their living costs through the courses. In the Chancellor's autumn statement last year, it was announced that student funding for these courses would shift from the NHS to the Higher Education Funding Council, and that students in these courses would need to pay tuition fees that they would then be eligible for student loans through. So it brings nursing, midwifery, and the allied health courses onto a par with other students in the university. Well, for the first time, health students get access to the full student loan system that other students in the university have had for several years. So actually that means that they don't themselves pay any fees up front. The student loan system takes care of that, and it gives them access to funds to support themselves whilst they're students at university, that they only start paying back when they earn over a certain threshold once they start working. And then it's paid back as a percentage of their earnings. And there's a sliding scale according to how much the salary is that students start working on. So at the beginning of their careers, they pay back a small amount and it gets higher as their earnings increase. Well, under the new arrangement, students are reimbursed all placement travel costs after the first £300 of excess expenses that they incur in travelling to placements or other travel associated with their courses. But in addition to that standard arrangement, health students will get that £300 paid to them from the National Health Service, from Health Education England, as a one-off payment, each year to cover those additional costs of travel. So actually, any placement travel costs should be covered in full for health and social care students as part of that arrangement. Well, health and social care second degrees are exempt from the restrictions on students getting a student loan twice. So actually, if you've already got a degree, you can still apply for and get a second student loan to undertake a second degree in health and social care. Yes, there's specific grants available actually, which are not to be paid back to support students who have parental or childcare responsibilities, and those are all detailed on the Funding Clinic website. Well, at the moment, there are an enormous number of vacancies in the National Health Service for nurses, for midwives, and for allied health staff. Nationally, in adult nursing alone, there are something like 10,000 unfilled nursing posts at the moment. So students leaving university now are not going to be struggling to find employment. I don't know there's that many other university courses that offer that level of employability. And employability at LSBU for our health students is 95% plus. So students leave here and go straight into jobs. The 5% that don't generally taking career breaks or starting a family or something. So those that want jobs get them very, very quickly. And most of our students, having left in the summer, are in post by Christmas of that same year. A lot of that is because London has very many more vacancies than the rest of the country. So big hospitals, big teaching hospitals in London have huge numbers of nursing vacancies and a high turnover of staff every year. So prospects for the first job in London are very high indeed, but also because of the turnover of staff in the big London teaching hospitals, opportunities for promotion and career development in London are also fantastic and probably better than elsewhere. Well, I'd urge anybody interested in coming to study nursing in London or even the southeast of England to come and have a look at LSBU, to come and find out for yourselves, talk to our student ambassadors here, visit an open day. We're going to be organising events with our local NHS partners. We work with most of the big teaching hospitals across London, so Guy's and St Thomas's, Great Ormond Street, South London and Maudsley, King's College Hospital, Barkinghaven and Redbridge, Barts Health. Now I could go on. We work with something like 60 different NHS organisations in the capital. I don't think there's a university that works with more than those. So I think, come and find out about us, talk to our students, talk to our staff, look at the facilities we have in our fantastic K2 building here at the Southwark campus, and the great facilities we have out at Havering, Harold Wood, for our students in Essex. Well, for students who are seeking entry to the postgraduate diploma and master's programmes in September 2017, the arrangements are as they have been previously in relation to NHS bursary eligibility. So students doing the postgraduate programmes in September 17 won't be paying tuition fees. They'll have those paid for them by the National Health Service, and they will be eligible for the NHS bursary scheme. That's probably the last year that scheme is going to exist in its current form, and the government is currently reviewing how to continue to support students doing those pathways from September 2018 onwards.